and welcome to this weekend edition of the Chiefs. With us is Robbie Alampay of One News, and coming online, Robbie, coming online in a few minutes will be Ana Marie Pamintuan, na malamang magsasara ng dyaryo ngayon dahil ang dami nangyayari. But before we get to that, si Lucy Cruz Valdez is going to be off for tonight. Anyway, Robbie, let's go to what's developing right now. We understand na lumalaki pa ang lead ni Joe Biden.
Well, nung umalis ako ng bahay, that was the last time I checked. I think we're looking at the same numbers. But the big story, of course, was that mukhang nag-overtake na siya sa Georgia, no?
Georgia.
So the whole day we were seeing him, clawing at Trump's lead in Georgia. Yesterday it was in the thousands. Nung nagising tayo kanina umaga, it was in the low thousands. Tas over the course of the day, hundreds, until finally I think around 2 hours ago, nag-flip, biglang leading na si Joe Biden by 1,000. And if he manages to hold on to Georgia and Nevada, if I'm not mistaken, tapos na ang boxing, that gives him exactly 270.
Yeah. What you're seeing right now, what you were seeing a while ago was a map from Reuters news agency that showed or projects Biden having 253 electoral votes versus Trump's 214. So as per Reuters, 17 electoral votes na lang ang kailangan for him to hit the magic 270. And drilling down further yung sasabi nating Georgia, if you look at the map of Georgia, at least as per Reuters, pinakita kanina, come on, show it again, guys. Anyway, Georgia has turned blue or light blue, meaning na nag-lead si Joe Biden slightly. At least by the count of Reuters, Biden has 2,449,580 votes versus Trump's 2,448,484 votes. So maliit lang yung lamang, pero that's actually surprising kasi Georgia's always been red.
Pero ngayon, ang mahalaga kasi ngayon, kaunting-kaunti nila. I mean, less than 1% na lang yung binibilang nila. But a number of things crucial there. One is it's coming in from the major cities, Atlanta in particular, and that is heavily skewed towards the Democrats. And also, as with all the states, we're waiting for the count of the mailed-in ballots. And because these were early ballots, a lot of these are presumed, and the trends do validate that a lot of these will likely be Democratic votes.
And the other big story is that the President Donald Trump, again erupted into a tirade of, what they call unsubstantiated claims coming from the White House that he had been cheated in the elections. That's the president saying he was cheated in the elections. Can you imagine that being said by the president in the Philippines? Who's in power? Trump said they are trying to steal the election. He said that out loud, and sabi niya, if you count the legal votes, I easily win. They're trying to rig an election, and we cannot let that happen. That's according to the President of the United States.
Pero it's interesting. Even the Republicans, the establishment among the Republicans are trying to keep a safe distance from this kind of rhetoric because we're laughing about it. Kasi dito medyo sanay naman tayo dito. Ika nga natin sa Pilipinas. Walang natatalo dito. But in the United
States, sila rin pala.
Pero medyo malalim ang tradition ng respecting the institution, respecting the systems there. So it really says a lot na kaunting salitang ganun, kita mo. I'm fascinated watching the American networks.
That's it.
Diba? You could grant the biases on the different channels, whatever you're watching. But you could see na sincero yung skandalo sila dun sa term na fraud, diba? And at every turn. In fact, we read that just now sa big story.
There's Ami Pamituan.
Hi, Ami.
Hi.
Pinag-uusapan lang namin yung US elections, obviously. But I just read it kanina sa big story.
Nadinaya yung presidente.
Wala nang nagreklamo ng ganyan sa atin.
But what was fascinating was the three big networks. We read that as a news item in the big story kanina. The three big networks, ABC, CBS, and NBC. actually interrupted the speech of
Yeah, they
Trump
cut him off.
to fact check what he said.
Yeah,
I
they
mean,
cut him off.
I think it's really just amazing.
Which begs the question. I mean, it begs the question for all of us, including us in the Philippines. Now, what do you do when your source gives makes unsubstantiated claims
Mm.
on live television, especially
Mm.
if that
Kinat-off
source
nga.
is in a position of power?
Nga.
Kinat-off nga siya. Kaya nga
But
nagreklamo.
but I remember that's part of our conversations. Recently, I hosted a panel for the Daang Docu series of online seminars, and I hosted a panel with some senior journalists, Sheila Coronel, John Neri, Maria Reza, and isa yan sa mga tanong. I mean, si Jim Gomez was also there. And yung isang tanong, exactly what you said, Ed. Pagka alam mo nang hindi totoo yung sinasabi ng kausap mo, what are you supposed to do? Di ba? On the one hand, the people presume that we're just there to report what other people said. At the same time, there is that burden for you to look out and to be the instant fact checker. In fact, the real-time fact checker.
Mhm.
Well, speaking of
That's going to
Paul
be
Fraud, no?
a point of debate for a long time.
Speaking of Paul Fraud, tayo rin nag-uumpisa ng mag-prepare for our elections. Less than a year and a half away. At importante ngayon tong guest natin, it might play a role, di ba?
Yun, galing segue.
This kind of exercise, so sige Ed, pwede mo nang papasukin.
Okay. Well, as we promised in the introduction, sorry, napa-segue lang kami because it was also a breaking story that we had to talk about, and we are editors, so something we can't just avoid. Anyway, but as we promised earlier in the introduction, we are going to be talking about the national ID system, and the implementation began earlier this month. I'm sorry, last month na pala, November na nga pala ngayon. Yeah. So let's bring in PSA Deputy National Statistician, Assistant Secretary Rosalina Bautista from the PhilSys Registry Office ng PSA. Ma'am, good evening po and thank you for joining us.
Good evening.
Good evening po.
Nakamute po kayo.
Can you hear us, ma'am?
Nakamute po kayo.
Sorry, good evening,
Hi, ma'am. Good evening po.
everyone, and it's nice to be in your show this evening.
Thank you, ma'am, for joining us. Anyway, ma'am, we've been looking at some of the initial numbers, but we want to go into that in a while kasi you're looking at some healthy numbers for the first phase. Pero before we go into the numbers themselves, I suppose a lot of people are curious how you were able to register so many people. I think around 3 million people already during the pandemic. I think you began on first 2 weeks of October. And you've already hit 3.2 million registrants. How are you doing this with the pandemic?
Okay, let me clear, no? What we're doing now is just step 1 of the step 3 registration process. So step 1 is basically going house to house and then collecting the demographic information of the registrants, and informing them of their schedule. When is their schedule for the actual registration, which is the step 2, which is starting November 25. So yung step 2, that's where you capture the biometric information. And step 3 is when they are issued their PhilSys number and receive their ID cards. So why did we have to do the step 1? The step 1 was really to address the issue of the COVID. Since we cannot have people queuing in a registration center, so what we did was to have our own people go house to house to selected household heads. And these household heads are household heads that we got from the listahanan tree of DSWD. So sila yung mga, kumbaga, low-income household heads kasi sila yung priority namin for this 2020 operation of the national ID. But from January...
So yung 3.1, 3.2 million, ano pa lang yun? Data gathering and scheduling pa lang yun?
Yes, sir. So yung halos kalahati, more than half, mga 54% of this will be registered starting this November 25. And we hope to register at least 5 million by December 30. So yun yung actual registered na talaga.
So ano ma'am yung mga question na tinatanong? Kasi may nagpunta rin sa bahay namin, parang census naman yata yun.
Ah, yes, ma'am.
Anong yung name lang
Oo,
sa
hindi ka kasama sa pur sa dapur.
yung birthday. yung name lang sa yung birthday, yun ba yun? Hindi na
Sa ID po, tinatanong ang birthday.
yes.
So, kapag po may dalang tablet at kinuhanan ng retrato, tapos na may nakahawak na ID, ma'am, sa national ID po yon.
Okay. May picture taking pala yon.
Yes po, kasi yung pag-picture taking is a confirmation na pumapayag siya na ibigay yung information. Dahil para kung walang hahawakan na mga walang pipirmahan dahil nga doon sa COVID, so picture lang po. Kaya,
Siguro yung nagpunta sa amin. Ano naman yung kanina? Si BSP Governor Benjamin Jokno, pinuntahan yung machines. So nagkumpisa na ba mag-print?
ma'am,
Yung machines
ganito po yun. Ang BSP po kasi, the BSP ay yun ang mag-print nung card na gagamitin para sa national ID. So meron po tayong physical card. So it's an agency-to-agency procurement that we did with the Bangko Sentral. At dahil po secured yung lugar at may security features, definitely a lot of security features into the PhilSys card. So, Bangko Sentral po yun, and they will produce the card, and then yung ibibigay po nila sa amin ang blank card, tapos kami po yung maglalagay ng information doon sa card, pero within sa facilities ng Bangko Sentral. So, hindi po kung saan-saan lang.
So, ready na yung machine. Ready na to roll.
Yes, kailangan po kasing may capacity din po kasi yung machine na kailangan nila na binigay, na nirentahan nila. So actually, it was Bangko Sentral who did the procurement for us. And eventually, kailangan po mag-advance sila ng production dahil mas mataas yung output namin sa registration kaysa sa yung daily production nila. Kaya kailangan po may advance production sila ng cards.
Ma'am, on one level po, totoo na to, no? As you said, ang target natin 5 million dito sa initial phase. You're confident of getting that. But just to give us an idea of kung gaano ka laki tong programa na to, when can we expect all of us, all Filipinos, to be enrolled in the national ID system?
Our commitment to the administration is to complete 90% of the population by the end of the term of President Duterte. So we are targeting 45 million sa 2021 and 42 million in 2022.
Okay. Now in the meantime po, as we said, totoo to, notwithstanding yung inaantay pa natin yung iba and everybody's eager to have their national ID. Yung dun po sa mga mauuna, once they have their ID, once they're enrolled in the system, what changes for their lives as Filipinos?
Dahil po inuna namin yung mga low income, we are expecting that right now our statistics show the information that we gathered from those we have actually pre-registered in step 1, 88% of them are unbanked, which means they don't have bank accounts. And since they are the low income families, they belong to the low income families, if government has to provide assistance and whether it's financial, doon ipapadaan through financial institutions. Kaya the opening of a bank account is one of the objectives also of the national ID.
So you will have to talk to the banking system, no? Kasi yung sabi nila, humihingi daw ng di parang may minimum income. Maraming hinihingi ibang bangko eh. They will have to do away with those requirements.
Yes po. actually our agreement with the Bangko Central is, and of course with the Department of Finance also, is that they will allow the opening of bank account. In fact, kausap na rin namin ang kasama sa kinakausap namin at nakausap na ang Land Bank, although hindi limited sa Land Bank lang yung pwedeng mag-open ng bank account through the use of the national ID. In fact, ang sabi nga po ng Land Bank kahit nasa transaction slip pa lang, after the step 2, they are willing to open bank accounts for the registrants already. Na hindi pa nila nakikita yung ID card.
It's not just private transactions, it's not just bank transactions. Obviously, the biggest thing that has people excited about this is government transactions should become easier. Now, that reminds me of a question na pinag-uusapan po natin itong ID system, pupunta sa ating taong bayan. This is about the citizens. But what about on the side of government, whether it's a government agencies or LGUs for that matter? What are we doing and how can we be sure na pagka may national ID na ako na napaka-high-tech, is that the government agencies that I'm dealing with are equipped and actually have the system and the machinery and the technology to deliver on the services?
So we also have, they will have to have the authentication devices that will be necessary to do an online identification. Yung offline, okay din po. Kasi physically, in the card, you will see the picture and the information. But if you want to do higher verification and you want to do an online verification, you will have to have the authentication device. And we have trainings. There will be trainings on that. There will be MOAs with relying parties and trusted parties that will have access doon sa authentication services that will allow, like kunyari po yung PhilHealth, definitely they will need it pag kailangan. So importante, yun ang by 2021, actually we're already working it out itong 2020, but by 2021 definitely the use case will be in and authentication services should be there kasi that's where the appreciation of the national ID comes in.
Kasi ngayon, kaya ko lang naman po natanong kasi sa totoo lang, di ba, ngayon, pag minsan pupunta ka sa kung ano-ano, supposedly electronic yung mga transactions, gumawa ka na ng nag-online form ka, supposedly e-governance, mataas naman ang grade ng Pilipinas, dala mo passport mo, dala mo tapos pagdating mo doon, parang ano ba to? Nag-online transaction pa ako, nag-online form pa ako, pagdating ko dito, papapirmahin din ako dito. So you're saying, ma'am, na when you say that you will deliver by the end of the President Duterte's term, end-to-end to, both on the side of government and on the side of the citizens?
Yes po, of course it will take, syempre po mag-a-adjust pa yung ibang sector. So, but we are, in the law, it says that government offices and even private sector should honor the ID. In the law, the ID is actually foundational. Yun ang purpose. I am who I say I am. But people, there are already those who are looking at it as a functional ID. Yung pwede mong lagyan ng pera, pero right now, ang ginagawa pa lang po is functional, foundational pa lang. Kumbaga pag pinakita mo, siguradong sila, ako si Rosalina Bautista.
Ma'am, at the start of the show, we were talking about the election. Magagamit ba ito sa 2022? In lieu of a voter's ID?
I heard, this is what I heard, that COMELEC has stopped issuing voters ID. Kasi pag pinakita mo na yung yung national ID, then it will be easier for you to register kasi hindi na sila kumbaga, once na ma-authenticate nila na ikaw to, it will be easy for you to be registered. And they can check whether you're registered somewhere else if they have a good system, no? Yung COMELEC. But we are also working it out with COMELEC ngayon kasi meron po kaming i-discuss with COMELEC on validation of COMELEC IDs kasi po parang ang biggest na source ng ID card na meron ng mga tao, number one is the voters registration ID or certificate.
Kasi kung operational na siya, itatanong ko sana, will it help minimize, halimbawa, flying voter and other forms of electoral fraud? We were discussing this at the start of the show. Makakatulong ba siya?
Makakatulong po siya in the sense that if you register now and then this is your name, you cannot have another ID na ibang name mo. Na kumbaga tapos boboto ka sa kabilang tao. Kasi doon po sa national ID, madetect kung kahit na magkaiba ang pangalan mo, kung pareho ang fingerprints at iris. So makikilala ka po doon.
Asec, could you please review for us exactly what data sets will be made available by the national ID system to all the other government agencies and possibly to other individuals or groups? You do remember, of course, before there was some concern by some groups na data privacy issue. Could you review for us exactly what will be made available to all these agencies and if at all private groups or individuals?
Actually, sir, yung data cannot be pushed to any government agency unless with permission by the owner. And usually this will happen only during authentication. Na kung pumayag siya na kukunin yung information mo na nasa database. Pero ang information naman po kasi na nasa national ID ay pangalan, gender, birth date, birthplace, blood type, the address, permanent and present address, whether you're Filipino or resident alien, and of course, marital status, mobile numbers, and email addresses. So these are not all of them are really very confidential and you actually see them in your ID. Pero yung biometrics at saka yung iris, hindi mo naman po makikita doon sa physical ID.
Okay.
So,
Is there any, kasi may commercial value rin, ma'am, yung yung for example, telephone numbers and email addresses have commercial value, not to the government, of course, but you know how it is. Minsan may nagli-leak o na access na databases not from your end, but sometimes that does happen. So
sinishare po kasi yun eh.
Oo nga po.
Pag pumirma ka sa mga, di ba sa contact tracing, nakalagay po yung iyong phone number, and then it goes to, yung mga nagpapadala ng mga shop, yun ang magbebenta sa'yo. In our case,
even before the pandemic, binibenta na yung mga numbers yan eh.
Pero very important po kasi yung mobile number sa amin. The mobile number will be used 3 times for three purposes. One is to inform you to remind you of your schedule for registration for step 2. The second is to inform you if you have been successfully registered after you have done step 2. Kasi mga 2-3 days po after the duplication or validation, you will be informed that you have been successfully registered or you were not successfully registered. And the third one is, should there be a change in your registration center, then you will be advised. So dun lang po ang gamit nung mobile number for as far as the PhilSys is concerned.
So I mean, I question there, especially because we're starting with the poorer sector. What does that mean? Does the number have to be unique to you for these 3 initial steps? Or kasi I imagine some people they'll just use yung number ng kapatid ko. Diba? Or wala ako or maybe they're sharing a number. Does the cell phone number at the start and at this foundational stage, does it have to be unique to every individual? Does it have to be, for that matter, owned by an individual?
No, sir. Ang importante po is we have a way to contact you, but we have also indicated in the information whether the cell phone belongs to the person or the cell phone number belongs to a member of the family or the cell phone number of a neighbor or the barangay captain in cases sa mga rural areas.
I see.
Ma'am, another issue there, although medyo tangential siya, is most Filipinos actually really own prepaid SIM cards eh. So medyo temporary yung yung
Apo,
yung mga numbers ng mga tao
numbers.
So how
Kaya
does that
nga
go?
po, doon lang namin talaga siya gagamitin. So, ang ina-advise namin, sinasabi namin, huwag po kayo magpapalit ng cellphone until madaanan nyo yung step.
Until
Only for that short period of time.
So it means in the processing period yung kailangan, but once you have the ID and you're entering into the system is not tied to your permanent cell phone number.
Yes, no. Because we know that Filipinos change numbers.
Yung iba
So,
naman yung
sinasabi rin po namin na kung may magsasabi na naniningil sila or what, please ignore them. Kasi hindi yun ay taga-PhilSys. Tapong bayad yung ating ID. And these are the only times that we will be sending a message.
Right.
So, libre.
Libre po. Libreng-libre yung ating ID until the issuance. Huwag lang pong mag-request ng replacement.
Okay.
Yeah.
Huwag niyo iwawala.
Maraming salamat po.
Actually, kahit naman po mawala yung physical ID, if you have your tokenized yung number, kasi hindi mo po makikita yung pinaka-PhilSys number. So, it's iba yung Phil ID na nandoon. So, you have that number, then it's still okay.
Nice.
Ma'am, baka pwedeng ID sa sa RFID, insert ng RFID sa register kasi magkakaiba pa sila ng sistema.
Actually, sir, we foresee that eventually, pag nag-apply ka ng RFID, hihingian ka ng national ID. Parang madali na nilang malink. Itong sasakyan na to nakalink dito sa taong to.
Pati sa kanila magagamit. Okay.
Magagamit po yun.
Actually, one last question I wanted to ask kanina was had to do with the cell phone numbers kasi the Philippines is pretty loose when it comes to prepaid cell phone numbers, prepaid SIM cards And in other countries, medyo mahigpit yan. You have to register before you can get even a prepaid SIM card and so on down the line. I'm wondering if in your discussions, in your policy discussions, that's the direction we're headed towards for more or less kahit paano regulated or controlled system of cell phone.
Parang earlier po there has been attempt na i-register kahit na prepaid SIMs, di po ba? Kaya yung nabibili na SIM ay dapat mag-present. Yung bibili ng SIM number, there has been, I don't know whether it pushed through, but ang tingin ko baka eventually that will happen. That even if you prescribe, kasi parang nire-regulate din nila yung SIM, so they will ask you to present an ID, a national ID, which will eventually will force everyone to have a national ID because maraming bagay ang baka magkakaroon ka ng some limitations because you don't have a national ID.
Ma'am, just to be clear, because we don't want to get you into trouble, you're speculating here or you're theorizing that you see the use case moving that way. Because, like you said, it is a controversial proposal. There have been, and of course, but dito po sa nai-imagine nyo na baka mapunta doon, baka inevitable na mabuksan yung usapan na yan, we will then be backing into a law that or a policy or a system that people have been actually railing against na ayaw nilang mangyari yan, di ba? So kung hindi nakuha sa batas, the technology might actually open up the possibility and then we will back ourselves into that controversial law.
Ang nakalagay naman po talaga doon is the ID will be honored by government offices and even by the private sector. So it will be just up to them if magiging part of their requirement yung need or for the owner or kung sino mang client for them to show a national
Okay.
Okay, salamat po. Asec Rosalina Bautista ng PhilSys Registry Office ng PSA. Ma'am, thank you for joining us tonight.
Thank you.
Thank you very much, Sir Ed, Sir Robbie, and Ma'am Ana.
Thank you.
Thank you.
Thank you po. Oh, Ma'am Ana. We will
Ana
just go
Marie.
into a break, so please stay
Ana
with us.
Marie naman.
Mga plan.
Welcome back to the Chiefs. We're now in the final stage of our conversation. And now we move to another topic. We'd like to welcome our next guest, Dr. Carla Ante Orozco. She's an immunization specialist of the United Nations Children's Fund. Good evening, Dr. Orozco.
Good evening,
Reading, Doc.
Sammy, and good evening,
Welcome to the
everyone.
Chiefs.
Thank you.
Yes.
Thank
Good
you for
evening.
having me.
Yes, Doctor, we had images today. Our photographers went out and meron kami mga picture of children being immunized. How is the immunization going considering all the restrictions during the pandemic and considering the previous fear of, well, because of the scare over Dengvaxia, there was a resistance among parents now. I think it's still persisting. How is that going? How is the program going along?
Okay, so there's an ongoing campaign that started October 26 and will go on until November 25. This is the measles, rubella, oral
Yeah.
polio vaccine campaign. So this is ongoing in Mindanao regions as well as in selected regions of Luzon. So this is CAR, Region 1, Region 2, 4B, and 5. Um, uh, it's challenging to actually mount a campaign amidst this pandemic, but there has been a very good also turnout in most of the areas. But there are also challenges. There are areas that are in lockdown. There are also health workers that are victims themselves, so they are also in quarantine. In terms of refusals and deferrals, so we're seeing also some of this, but mostly the reasons are the child is sick or the child is away from the home or the mother is not there to give consent. There's still those fear of the vaccine side effects, but we're not really seeing a rampant refusals due to the infectious scare before. So yeah, it's
Mm.
still ongoing, but in terms of the coverage, it's still at for measles rubella at 47%. So there's still a long way to go. There's still around 2.2 million children under 5 that are still not yet vaccinated for measles rubella. And for polio, around 1.3 million children are still to be vaccinated.
Ah,
Doc, linawin ko lang because nga to Ami's point nung going back to Dengvaxia, there really was a demonstrable spike in the anti-vaxxer community. We would hope that's a small community relative to the rest of the population. Pero tumaas talaga yung apprehension. What you're saying now is that you're seeing that going down a bit at mas panatag. It's really for more pragmatic and more reasonable reasons that people are declining or not making themselves available.
Yeah, I would confirm that as well. I would agree to that statement. Well, the Dengvaxia scare that started in 2017, it was really felt immediately after, so around 2018. So there was also, in terms of routine immunization, there was a decline in coverage that really contributed to it. But it's not just the reason, in terms of the decline in the coverage. And we also saw there was also a campaign in 2018, and the effect can also be felt there. But the campaigns that went on in 2019 and for the polio outbreak response, and even this year for polio as well, early this year and around September for Region 3 and 4A, there was a good turnout actually, and it was not really a major reason for refusals or
Mm.
deferrals.
Okay.
Doc, with the pandemic that we have now with COVID-19, everybody's been talking about and hoping for a vaccine very soon. I'm wondering lang given our problem in with 2017's Dengvaxia and how it affected the attitudes towards vaccines then, with people looking forward to a vaccine now against COVID-19, is that in any way helping how people look at vaccines, confidence in vaccines? Is it an unexpected side effect of the pandemic?
Well, that's true. So they're looking at the COVID vaccine as the silver bullet, no? But actually, it's not actually. So, well, I would like to think that the uptake or the way people see vaccination has also changed. They see it as really this is something that can prevent more diseases and more deaths from happening, because that's really what vaccination is. It really helps prevent vaccine preventable diseases and deaths. And well, hopefully with the hype on the COVID-19 pandemic that we have now and the sort of excitement for this COVID
Mhm.
vaccine, we hope that people will also take this, welcome this vaccine. But of course, we are also taking note of possible anti-vaxxers as well. So we will be helping the Department of Health in coming up with communication strategies, risk communication as well, to provide the right information and awareness towards vaccination as a whole.
Doctor,
Okay.
because
Now,
vaccine scare, we saw a return of polio a couple of months ago. Would you be aware of the current situation now? Have we stopped the spread of polio? I know it was just a few cases, pero considering that we had 0 cases already for a very long time, people were so concerned about it. Kumusta na po yung situation yan, yung polio situation?
Yeah, that's true. So we were polio free for almost 20 years, right? So we were declared as a country as polio free since 2000. But last year, sadly, because of the decreasing coverage and the increasing pool of susceptibles, so polio came back. So for now, we actually have 17 cases already. We're not yet over. We're still seeing these additional cases. So polio transmission is ongoing, the outbreak still ongoing. So we should not put our guards down. So that's why the polio vaccination campaign, the campaign that we're having now together with the measles rubella campaign, is part of the bigger polio outbreak response for the country. So yeah, surveillance is also being heightened to really check on, are there possible still polio cases in the community? So yeah, so just to answer that polio virus transmission still ongoing, the outbreak still ongoing. So we should let our children to be, you bring the children to the health centers to be vaccinated for this campaign and even during routine immunization as well.
I was looking at that chart na finlash natin kanina from the WHO. This was the assessment result in 2018, risk assessment result in 2018. 59% high risk. Third, if you add, medium to high risk, that's practically 91%. Are we still there? I mean, given that this is 2018 risk assessment result, 2 years later, do we say that this is still the state of the Philippines?
Yeah, although we had done polio campaigns last year and this year, the whole country is still at risk for polio virus transmission. So yeah, I would say that that still holds true. Although we're seeing, well, because of the massive vaccination campaign, polio vaccination campaign, we might be increasing population immunity slowly, but still the
Hmm.
country is at risk.
What in that map, in that heat map that we're looking at, some regions are yellow, some are red, some are. What are the factors that go into categorizing particular regions or provinces as high risk?
Okay, so if you would look at that slide, so there are 4 criteria in categorizing. No, if This is province or cities that are high risk. So one is AFP is the acute flaccid paralysis surveillance performance. So if they have good surveillance or bad surveillance data, then that's a criteria there. So if of course immunization coverage for oral polio vaccine, especially on the third dose. Then another is the coverage during polio immunization campaigns, and of course environmental risk or sanitation. If a province or a city or a barangay has poor sanitation, then it's also high risk. So putting all these criteria into place, so if you have low AFP surveillance, if you have low vaccination coverage for routine immunization, if you have low coverage as well during the immunization campaigns, and there's poor sanitation, then you are at risk. So those are the criteria that was used.
Ulitin lang natin, AFP does not refer to the Armed Forces of the Philippines surveillance. What does it
No,
refer to again? What does AFP mean again? Acute.
that means acute flaccid paralysis. So that sudden,
Okay,
acute,
the symptoms.
sudden
Okay.
onset of, in layman, floppy paralysis. So not the
Okay.
spastic or not the. So it's so it's a sudden onset of floppy paralysis, and usually it's asymmetrical. So one-sided.
Nalalampa.
Yeah, sort of. Yeah.
It's a viral
Usually
disease.
low-
And how infectious
Yeah.
is it? Kasi it's pretty debilitating, How infectious it is. Saka ano yung pwedeng gawin ng mga tao to prevent infection? I mean, among children.
Yeah.
What
So it's
are
highly
the
infectious.
precautions?
Yeah, it's a highly infectious disease.
Yes.
It's a viral disease, highly infectious. The transmission is fecal oral, meaning if a child holds or touches something with contaminated with feces or waste which has the polio virus, and then she didn't wash or he didn't wash her or his hand and then eat, then the virus, the polio virus can be ingested, and it replicates in the intestine actually. So there's no treatment. There's no treatment for polio. As there's also no treatment for measles. It can only be prevented. So it can only be prevented by vaccination. That's the only way that polio can be prevented. Once it sets in, once paralysis sets in, then there's no treatment anymore. So you just manage whatever symptoms the child has.
Yeah, but in
Same
the
with measles.
meantime, maganda yung sinabi nyo, washing hands. So the same hygiene principles that we follow for COVID that is now universally recognized and hopefully taking hold in our public, the same good habits will also protect us from all of these diseases.
Yeah, it will help, but primarily it's really vaccination.
Okay.
Paano if there's one child in the family who is infected with the polio virus? Does the child have to be isolated from other children? Because we have a lot of big families still, no? Kailangan ba siyang ihiwalay?
Yeah, as much as possible, yeah. But then, as long as you take the necessary precaution of the proper hand washing, and proper sanitation inside the house as well, yeah, that can be, and proper, of course, disposal of the waste or of the feces. So yeah, it can be, but not really full isolation, but just using proper hygiene and sanitation within the house.
So, hindi siya kasintindi ng COVID. Hindi naman ganun na bumahin ka lang sneezing and coughing. Hindi naman
Hindi naman
ganun.
infectious.
No, but measles is like that. So
Yes.
measles is also transmitted airborne. So bumahin ka sa loob ng bahay, it's overcrowded, then tapos hindi na bakunahan, the children or people around are not vaccinated, then most probably they get measles. It's really highly infectious. So again, no treatment.
Yung percentage-wise, gaano kalaki na yung delay ninyo? Because we were told that in immunization program, you have to follow certain schedules, di ba? Nagka-delay na daw. Do you have to repeat it kapag na hindi natuloy? Yung iba daw tumigil, yung iba ayaw na talaga, but now they're going back. Do they have to start all over again?
Okay, that's a good question actually. So, well, principles of vaccination. Once you've started the dose, you don't have to repeat it. So there's like a memory cells, no? So
Yes.
you just go on with the next dose. But as much as possible, of course, you want to follow the schedule. But if there are delays, you don't need to repeat the dose. So you just follow the next schedule. So there is a minimum interval, which is more important, usually 1 month before the next dose. But there's no maximum interval. So you can give it
Okay.
maybe after
So
2 months.
walang
But I,
expiration yung
again,
first dose.
yeah, but
Okay.
again, I want to emphasize that it's more important to, to have the vaccine on the right schedule. Yeah,
Mm.
for protection.
Okay. So ang mga ilang dose pa yon? What about sa adults ba? Kaya pa yon? I know you're with UNICEF, pero sa adults, yung immunization, meron din bang ganon? Pagtanda-tanda
Well, there
nung
are also immunizations.
pagtandaan ng measles, nagiging na siya, parang hives na, di ba? Meron din bang ganong vaccination for that? Hindi siya
Well, there are
nagre-require.
also vaccinations for adults.
Yeah.
Well, if you're not vaccinated as a child, then and there is an ongoing epidemic or outbreak,
Yes.
then it's better to be vaccinated as well. Because as I've said, like especially for measles, it's highly infectious, so you can still have the shot. And I just want to emphasize that part of the vaccine that's being given now, and it's also part of routine immunization, the rubella component. So rubella is the German measles.
Yes.
So it's usually a mild disease for children, unlike measles. But when rubella, when a pregnant woman gets infected with rubella, the effect on the unborn child is really severe. Especially if the pregnant mom gets it on the first trimester of pregnancy, it can really cause deaths, utero, or stillbirth, or if the child is born alive, the child might have severe congenital anomalies or of the congenital defects. So the child could be blind, the child could have a cardiac problem or ear problem, hearing loss. So yeah, just to emphasize that rubella is also a disease that should not be taken lightly, especially for women of reproductive age.
If you've had measles, you don't need to be vaccinated na. Is that correct?
If you for childhood immunization, so at least you get 2 shots first. So this is during infancy, no? So for the government schedules, it's usually given the first shot of, it's now measles, mumps, rubella. So
Okay.
the first dose is at 9 months. The second dose is at 12 months. So at least 2, no? And then if you miss that, then there's the school-based immunization. So this is measles, rubella that be given at grade 1s and or grade 7.
No,
So
I'm
there are a
asking
lot
about if you've had already the disease, do you need the vaccination? Kasi it's I don't know how common it is. Yung ibang magulang, sinasabi nila, halimbawa nagka-measles yung isang bata, pinaghahawa-hawa na yung pinsan dahil it will give them the immunization. Tapos they will not go to the vaccination center anymore kapag gano'n nangyari. Is that correct? Sa bagay, ako nung bata ako, nagkaganyan kami. Hindi ako nagka-measles ulit, but I think it's still widely practiced now. Is that correct?
Well, okay, so I think we have to correct that as well because we don't know, no? Because measles can mimic a lot of other viral diseases. Kasi pagka may rashes, well, it can be rubiola, it could be rosola, so we don't know. So just to be sure also, it's still good to, yes, still have your child vaccinated kasi baka akala lang, but actually it's not. Then you get the real measles, then you get the complications, then the child might die of the complications.
Yes.
Hey, Doc, kamusta naman ang coordination nyo with LGUs? Especially now that we're trying to reopen at the same time, some are false starts and so on in the middle of COVID. Kamusta yung coordination nyo with LGUs? And given some of the real problems that still exist, what additional help do you need?
Okay, so our support actually for as for the vaccination program as a whole or the immunization program of the government, we support the government at the national level, but for this campaign specifically, but we also support at the local level as you are asking. So we have consultants on the ground to provide mentoring and technical support to the health workers, to the health teams, to the EPIT or the immunization teams in how to improve their coverage. We're also helping them in increasing awareness, now providing social mobilization support as well as advocacy support so that more mothers and caregivers will be aware of the campaign, and at the same time more local officials will support the campaign. So this is very important. So at the same time, we have an implementing partner that supports priority LGUs in also social mobilization and advocacy, because that's one of UNICEF's strengths, no? So that's the support that we give to the local government. So yeah.
Yung ibang illnesses na you're also involved in that, yung mga pertussis, yung mga whooping cough, the other immunization programs. How is that coming along? Yung ibang yun?
Yes. So that's still part of the national immunization program, no? So diphtheria, pertussis,
Yes.
tetanus, that's part now of the 5-in-1 vaccine that's being given in health centers. So that's Penta. So that's DPT, Hepa B, and Hib. So all the other vaccines are still being provided in the health centers as part of routine immunization. So we're really advocating to the government, to local government units, to not to take for granted routine immunization, even while doing this campaign. It's really very challenging, because how do you strike a balance, doing the campaign, doing routine immunization, and then you have to do also the COVID-19 response. But just to say that the government is also doing a lot on this. They're adding more manpower. They're hiring vaccinators for this campaign specifically, so that those organic health workers within the health centers can also do routine immunization as well. So yeah, it's really important to emphasize that these are also very important vaccines that should be given to children even during this pandemic.
How are your personnel who are undertaking the program? Di ba nagkakaroon din, hindi ba sila na-infect ng COVID? That's a concern. You're going house to house in some areas, di ba? Meron na bang mga nagkasakit as a result?
Well, first, the health workers, they are trained. No? They are trained on infection prevention and control for COVID-19. And when they do vaccination, they are wearing PPEs. They have face masks. They have face shields as well. And as much as possible, vaccinations are done in well-ventilated spaces. And of course, physical distancing, they're also followed. And limited number of caregivers can go in the health centers at one time. In terms of, there are health workers that were infected, but not because of the vaccination campaign, but in the course of their, in their work and maybe in their communities as well. And this has also affected, no? It's really a pity, because they're also victims themselves, so they have to go on quarantine as well. So yeah, it's challenging times, but they are very resilient as well. They're doing their best to do these services.
Okay. Dr. Carla Orozco, immunization specialist ng UNICEF Philippines. Doc, maraming salamat po for joining us tonight.
Thank you, Doctor.
Thank you. Good evening.
Thank you, Doctor.
Good evening po.
Nagpa-injection na ba kayong dalawa? Immunized ba kayo?
Parang sayang na lang sa akin eh. Save it for the kids.
Hindi natatablan.
Itatablan. Parang kabayo. Okay, it's a weekend. So,
baka
time to say goodbye. We'll see you guys on Monday. Hopefully by then, meron ng Pangulo talaga yung Amerika.
Okay.
Okay.
Kung hindi, baka marami mag-i-immigrate dito ng mga Amerikano. Okay. That'll be all for this weekend edition of The Chiefs. We hope what was discussed here will keep the conversation going. I'm Edwin of One News.
I'm Ami Pamintuan of the Philippine Star.
I'm Robbie Alampay. We are One News.